Are you just seeing such an increase in people who are wanting their implants out? Like,
To
are you just
me,
booked
it
out
will
for the next
become the
few years?
most performed plastic surgery procedure probably over the next 5 years.
Interesting.
Because now there's a lot
That's
more awareness. There's a lot
yeah.
less confusion about it. Hopefully, we've contributed to provide clarity to that through my show, Breast Implant Illness Expert, and then being on other shows like yours to share, our experience. I've done, like I said, it's about 1,600 explants over like 7 years and well over 3,000 consults for it. So I see 40 or 50 people a week.
Yeah, crazy. What else is part of the it's like you do you guys call it the HARP program, this accelerated recovery program? Is there stuff you do post-surgery that's, like, unique?
Right. So we talked a little bit about supplementation, but all of that's based on preoperative testing. And, when I was trained,
Yeah, I was gonna ask that. Do you do genetic testing before you do all of your surgeries?
right, it's funny how
Oh,
I was trained, and I had excellent teachers, but back when I'm old now, I'm 54. So when I was trained, like you looked at a complete blood count, your electrolytes, a echocardiogram, or I'm sorry, an EKG of your heart, and basically a chest x-ray. And they're like, you're good to go, Morgan. You can have surgery. Everything's fine.
right.
But if you're in your 30s, I mean, if all that's not fine, you got a problem. And
Yeah.
the things we do now are more based on functional genomics. So I want to know how your detox works, how you should be eating. And that's a saliva test. It really gives about a 100-page report. We use the DNA company out of Toronto. It's been great in terms of formulating what we use for inflammation lowering support. Um, then we look at a total tox test, and that's a urine test. And you want to see, like, has there been a big mold exposure? So it looks at all the various mycotoxins from molds,
Interesting.
in particular, something like ochratoxin from black mold. And then, of course, it's looking at heavy metals. I discussed on the Skinny Confidential podcast, like how many heavy metals can be in someone's tox test. And then when you're looking at um, think of like environmental exposure. It gets a little in the weeds here because not everybody's very familiar with some of the things I'm going to talk about. Glyphosates is a desiccant and herbicide that's used on crops all the time.
Yeah.
So when you get a tox report that has glyphosate, like my first tox report had glyphosate in it. I grew up not eating great foods. And now, my wife's great. She makes sure like we have all organic stuff and it's all grass fed, no hormones. Well, I grew up as a kid that really wasn't a thing.
Yeah.
So that's one way to get glyphosates. Phthalates are plastics in plastics. So like a water bottle, they make the bottle firmer and that stuff gets into the water and you drink it and you absorb it. And that's how you get phthalate exposures. It's also in receipt paper, the thermal paper on
Yeah.
receipts. So it's a very common way to get phthalate exposures. And then a lot of things that you probably would know from products are as we want, and I tell all of our patients, like, do not get anything that doesn't say paraben free. Like, you can't have parabens in your products. They're easily absorbed through the skin. And so you'll get a bunch of different exposures. There's three out of like a litany of exposures that you can have. So you take that and couple it to, we do a food sensitivity test that looks at 250 foods and a gut microbiome test. We just are trying to figure out what triggers you and then how many, things are imbalanced in your gut. You add all that to some blood work to look at your hormones because your sex hormones are important and all the things I mentioned in terms of your gut and any kind of environmental exposures from parabens and phthalates, they all are endocrine disruptors, and women are particularly sensitive to that. So your hormones can be, on a whole, I think I see just a ton of hormone imbalance, thyroid hormone imbalance, estrogen, progesterone, testosterone. In particular, I get a lot of people with really suppressed libido. So think of that. Like if your vitamin D metabolism is poor, if your methylation pathways don't work well, if your inability to, handle antioxidants, like all the things that would be normal for sexual health, and you have suppressed testosterone, like it's a wonder why people have poor libidos who have breast implant illness. Like all of it is just really complicated when you put it all together and look at it. So we get all that testing done through it's all functional, like saliva, blood, urine, stool. we get all that. It takes several weeks to months to get all of it back. We put you on the inflammation lowering support bundle, and then if the tox test comes back poor, we're going to put you through phase 1 detox, and we have a partnership with Cellcore, so we use their products, and I have a practitioner who just focuses on that in my practice. Because of the way it's working, we take a time period of 4 to 6 months to get people prepped, usually for surgery, before we do their explant. We have a series of medications we use the night before just to calm down the nervous system, decrease nausea, decrease inflammation. And then in the operating room, once I do an explant, we're taking everything out as undisturbed as possible, because there are a certain number of breast implant associated cancers, as well as, like, my patient had an infection. So I don't really want any of those things getting into the
Spreading.
pocket.
Got it.
And then we have a medication that's widely used called Exparel, and we numb all the areas up as much as possible, so that when you're waking up, you don't really feel anything sharp or stinging. Lasts about a week. And
Okay.
I don't use drains. We've worked out how not to use drains,
Oh, that's
especially when
nice.
I do fat transfers. We just connect the pocket with the spaces where I've done some of the fat removal, so it just drains internally. And then the next day, folks come to my office. I have a hyperbaric chamber in my office, and we have a lymphatic masseuse and lymphatic massage device. So we're trying to get all of that done while most people are here about a week. And then it's just about proper diet, supplementation. You know, I like people to walk and, recover and not overstress themselves. So the more we have you here, the better. Some people try to keep changing their plane tickets so they can't leave, which is totally fine
Yeah,
with us.
sounds great. Sign me up. This is like mommy camp or something.
Right.